Today I want to talk a little bit about exercises. Patients come to me and they say, "Doctor, you're helping me with my back, you're helping me with my neck, my low back, my mid back pain. What can I do to help myself? What exercises do you recommend?" It's a very difficult question for me to answer because usually when you first come into the chiropractor's office, you're in a lot of pain. I do not recommend exercise while you're in pain. Now the thing is, there's certain types of stretches and certain types of things that you can do to alleviate pain, and I will show you a couple of those during this video. But as far as exercises, my advice is come see the chiropractor and get your spine back into alignment because you've got nerve interference, you've got nerve impingement that are affecting your muscles, that are affecting your spine and your overall health. If you do not address this, exercise may make the situation worse and you might have more problems. That said, I want to show you a few things that you can do to help yourself in your neck and your mid back and also your low back. So let's start with the neck. Now, the first thing about the neck is that it's made up of 7 bones, the first cervical all the way down to the 7th cervical, okay? And then you start getting into the shoulder region. Every nerve in the shoulder and the arm comes from the neck region. It goes through something called a brachial plexus. I don't want to get into that, but that's the point. There's a lot of nerves in your neck and in your low back. So when you're exercising, be very careful that you don't irritate these nerves even further and cause more problems. For the neck, after an adjustment in particular, you want to make sure that you keep limber as much as possible because you've just had an adjustment, you've just been put back into alignment. Chances are that pain is going to return. And when it does, you need to come back and see your chiropractor so that he can help realign you again so that the body gets used to being in alignment rather than in a pain alignment. So with the exercises, the main thing to understand with neck is that you want to keep your neck limber. You want to stretch it this way, that way. You want to drop it this way, look the other way, drop it. Do your neck around this way. Do a rotary motion. Just exercise your neck, not in a forceful manner, but in a very relaxed manner so that there's a stretching going on in the neck. Some people use a little pressure against this and that. What I don't want you to do is take your neck and start jerking it one way or the other just to get this cracking sound. A lot of people say they do that. I advise against that because it does not help. And you're going to end up with arthritis as you get older. Arthritis in the spine is not a good thing to have. If you want to do other things, you can do shoulder rotations. This also helps with the neck and the upper mid back. And what I also recommend to many patients who have neck, particularly neck and upper back problems, is to do a rowing exercise. And that involves taking a rubber exercise band and you're going to connect it to a rod in the distance and you're going to have both ends free so that you can grab a hold of them and do what I call a rowing exercise where you're bending forward and then you're pulling back, shoulder level, throwing your head back and your arms back about the level of your shoulders so that you get a full extension like that. When that happens, you just, again, release it and then you repeat. And you do this about 8 or 10 times. This is a very light resistance exercise that allows you to develop the muscles in the upper back and this muscle called the trapezius, which has different parts which goes up into the neck, into the shoulders, and into the mid-back. So when you exercise that muscle, you're going to feel a great deal of relief, and you're going to have a stronger back, which is supporting both your back and your neck to feel better. When it comes to the low back, the exercises that I normally recommend have to do with just stretching, because it depends on how your low back is paining. If you have pain from a disc problem, there's one thing I recommend. If you have pain from a spasm in the psoas muscle, there's an entirely different procedure. So you need to understand what the pain is and where it comes from in order to do the right thing. Now, I'll give you both of what I recommend, which is if it's for a disc problem, I'll show you have to lie down on your back. And you can bring your knees up like this, okay? And usually what you want to do is take a deep breath and then blow it out while you bring your knees to your chest. What this does is it opens up the disc area in the low back. By opening up the disc area, it allows the disc to expand, to be more free. It takes more pressure off the low back. For example, this would be a herniated disc. You want to not remove the herniation, but you want to stretch the low back so that the herniation is pulled back inside. It takes the pressure off the nerve roots the nerves that are coming out from the spinal cord there, and it will give you a lot of relief if you do that. The second exercise, if it's a deep psoas problem, that's a different exercise, and I need to show you that because it's more complicated. So come to Dr. Spine. If you do have a psoas spasm, which feels like a disc problem, but it's not, I can detect both and give you the exercises that you need in order to correct that, or at least keep that stable. I'll also do some direct work to release that pain and release that muscle so that you have relief. Now, as far as mid-back goes, mid-back, again, light yoga exercise is very good. Stretching is always good. Like you're stretching this way, you're stretching this way. This is also good for the neck and the low back. Just doing side-to-side stretching, twisting motion, where you're doing like light yoga twisting, like this way or that way. A lot of different things that you can do for yourself. Most of them are very easy. You don't want to push yourself into exercise, because exercise is actually an inaccurate term. You want to call it stretching or light movement exercise, because that's what your body needs when it's healing from pain. And if you have pain in the back and the neck and the low back, you've got a problem. And when you have a problem, exercise can only make it worse unless you do the right things. The main exercise I want you to do is to get in your car, push on the accelerator, and drive down to Dr. Spine to see this, because that exercise is going to get you the most help. When you come see us, we'll take care of you and you'll get better. That said, I hope to see you soon. Thank you for joining me. I hope to see you at Dr. Spine and Whitefield.